Have all the headlines about hormone replacement therapy left you feeling confused or unsure about whether it's right for you? You are not alone. For years, mixed messages have made it difficult for women to feel confident in their choices around HRT. But today, I've brought in the perfect expert to help us separate fact from fiction. Today, we'll explore what HRT really is, who it can help, and how to make an informed decision for your unique body and health journey. Because after all, you are the CEO of your body. Welcome to Pleasure in the Pause, a podcast dedicated to inspiring midlife women to feel more connected to their bodies, pleasure, and power through perimenopause, menopause, and beyond. I am your host, Gabriella Espinosa, women's health and sexual wellness coach, and it is my pleasure to be here with you. Today, we're diving into a topic that is both empowering and often misunderstood: hormone replacement therapy and its role in navigating menopause. If you've ever felt overwhelmed by conflicting information about HRT or wondered about alternative options, this episode is for you. I'm thrilled to welcome a very special guest to the show, Jill Chmielewski, a registered nurse, certified health coach, and fierce advocate for midlife women. Jill is on a mission to transform how we approach menopause and aging, showing us that midlife isn't about decline. It's about stepping into a vibrant, balanced, and empowered version of yourself. In this episode, Jill will help us unpack the mysteries of HRT, what it is, how does it work, and most importantly, who can benefit from it and when. We'll also explore the latest research on risks and benefits, clear up some harmful myths, and talk about what options are available for you. Plus, Jill will share how to find the right practitioner to guide you on this journey. Let's get ready for an education on hormonal health with Jill Chmielewski. Welcome, Jill.
Oh, thank you so much for having me. I'm so excited to be here with you.
Oh, thank you so much for joining me today. I'm so thrilled to have you here because I know how passionate you are about empowering women to take control of their health and navigate midlife with confidence. Your work as a menopause educator and advocate has helped so many women, including myself, understand their bodies better and feel more informed about their options, especially when it comes to menopause hormone therapy, or HRT as it's also called. Before we dive into the big questions, I'd love to start by hearing a little bit about what inspired you to focus on menopause and midlife health. What sparked your mission to change the way we approach this pivotal stage in women's lives?
So I've been a nurse for 31 years this year, worked a lot of my career in women's health, never learned about hormones. So hormones were really never on my radar, even though I was in women's health. And fast forward, I went back in 2015 to become a health coach. And I started working with patients, clients, and I was finding most of the clients I was seeing were my age. At the time, I was like in my mid 40s, and I was seeing universally the same sets of symptoms, little variations, but a lot of what I was seeing in my 40-something patients, some of them in their 50s, were symptoms that were related to hormones. And I kind of had enough knowledge to know that, but I didn't really understand perimenopause or menopause. In fact, I don't even know if I knew the term perimenopause at that time. And I started deep diving, and I was in that stage myself, and I started going through more training, reaching out to experts in this field, learning more about it. And I felt like I never really wanted to touch the menopausal women. I was like, those women are outside of my comfort zone. But when I started diving into hormones, I realized so few of us are educated about what happens in this stage of life. And we spend a third to half of our lives between perimenopause and menopause, and we have no idea what's going on. So I don't know, I think I'm a curious person by nature, and I just kept going, and I found myself loving this area and finding that women are hungry for the information. And so it's just spurred into me now being in this menopausal space and feeling like everything has led me to this point, I think, in my career.
I love that story. And I agree with you. There's so little we know about hormones. And I've been on webinars with you. I've attended several menopause conferences, and it's so fascinating to see, yes, how women are craving this information, because we've woken up to the fact that, oh my gosh, we know so little about our bodies, and why have we not been taught this? I felt I was pretty educated and knew everything I needed to know about my periods and giving birth and having babies, and period. End of story.
Yes.
Nothing
Exactly.
else. And then, the shock and really, I don't know, injustice that we've experienced as women to not be given more information about our bodies. So that's why I'm so grateful to educators like yourself. I've attended several of your educational webinars and really appreciate how you break down seemingly complex medical topics in an easy and digestible way, especially when it comes to hormones. I love your hormone talk.
Yeah.
So I'd love to start there. Tell us, why are hormones so important? Could you break them down for us? What are the key hormones at play during perimenopause and menopause? And why do their decline have such a profound impact on our bodies?
Yeah. So we, as girls, right, in our middle school years, we're taught about periods and pregnancy. We're not really taught about hormones. But I think we think about estrogen. We may have heard the terms estrogen and progesterone during the course of that time. But actually, we have estrogen, progesterone, and testosterone. We think about testosterone as a male hormone, but actually, women have more testosterone than they do estrogen, much less than a man. But we have a lot of testosterone too. So when I'm thinking about perimenopause and menopause and why there's this drastic change happening, it's because we have these key hormones, estrogen, progesterone, and testosterone, that are on the downward decline. Now, we all think about hormones in general as, like you said, it's periods, it's reproduction, it's pregnancy. But actually, the way that hormones work is we make hormones in our body, largely in our ovaries, we make them in our adrenal glands, and they get sent out through the blood. That's the highway that takes everything to where it needs to go, nutrients, hormones included. And it takes them through the blood to cells throughout the body, not just the ovaries, not just the uterus, not just those reproductive organs, but through to every cell throughout the body. Every cell in the body has what we call receptors for hormones. They're like little mini satellite dishes that receive hormone signals. So we have hormone receptors on our brain, our bones, our blood vessels, our skin, our vagina, our vulva, our urinary tract, our heart, our liver, our digestive tract, our kidneys. So every single cell of the body is going to be impacted when those hormones start to decline. That's why I think when women say we've thought about menopause traditionally as hot flashes or night sweats and maybe some period changes, but actually anything in the body can be affected. The brain fog, right? Our oral health can be affected. We have hormone receptors in the mouth. We know that as estrogen goes down and the hormones go down, macular degeneration risk goes up, blood vessel changes happen. So cardiovascular risk goes up, bone changes, osteoporosis, fracture risk goes up. You name it, every system is impacted. There's just signals going out to all these cells all the time that are affecting really every aspect of our health, which is why they really should be not called sex hormones anymore, but just really whole body hormones.
That makes so much sense in terms of my own experience going into perimenopause, some of the symptoms I experienced, and specifically anxiety, low mood, just irritability. And that term, I just don't feel like myself anymore. So many women I talk to experience that. And we don't think about our hormones, that it has to do with our hormones. What's really going on? Can you explain what's going on with the fluctuation of progesterone, estrogen, and testosterone, especially in that early perimenopause phase, which can last, we know,
a long time,
decades.
It can be a decade or more. So we start to make hormones in puberty and then they peak in our 20s. So if we think about, here's our 20s, average age of menopause is 51. So we've got this 30-year time span, right? So peak, here's when hormones are going to be at their lowest or they're going to continue to get lower. But there's this 30-year time span in between our 20s and our 50s, right? So hormones, even in our 20s, are then on the downward decline. But then in our 30s, typically our mid to late 30s, could be early 40s for some women, could be early 30s. The first hormone to decline is typically progesterone. And progesterone is the hormone. We actually make progesterone all cycle long, but we make huge amounts of it when we ovulate. So if we're not ovulating, we're not making progesterone. But if we are ovulating, even when we're ovulating and having regular cycles, we still will start to have less and less progesterone production. So in our mid to late 30s, we might experience things like sleep issues, really big with progesterone. You're alluding to mood issues, so anxiety, some depression. We can have weight changes, just general whole body changes. We can have more fatigue. This is where we can see some period changes because Estrogen is really responsible for promoting the growth of the uterine lining. Progesterone controls that growth. So if we're still making estrogen early on, but progesterone is declining, we might have heavier periods. We may have more clotty periods. We may be more prone to developing fibroids and polyps and other things that are related to this imbalance between progesterone and estrogen. And then following that decline in progesterone, what typically happens is, again, everyone's different, but we will see this period of time where we have erratically fluctuating estrogen. So if we drew your blood level, at one point it could be 800 picograms of estrogen. We could draw it later and it might be 50 picograms of estrogen. It's literally going up, down, up, down, up, down. So to your point, I'm happy, I'm sad. I'm anxious, I'm not anxious. I feel level, now I don't. I'm not sleeping well, I have hot flashes. It's going up and down. And so we can feel so many different things when we've got progesterone on the decline and estrogen going up, down, up, down. It's like ping pong in our brain. And because those hormones have a lot to do with neurotransmitters too. So we don't feel like ourselves. Everything can change. And then estrogen will ultimately, usually in the last couple of years, as we're heading into menopause, estrogen will be on the downward decline. So it's sort of like progesterone's declining, estrogen's doing this erratic thing, then it will start to decline. Testosterone, it's mixed. We see some women that come into perimenopause in their 30s and they have very low testosterone. Some women have high testosterone, some it's in the middle. But we know that ultimately, just like the other hormones, testosterone will decline as well. And that was actually the first sign for me in my 40s was testosterone. It's that memory, mood, motivation, like I got this kind of feeling. Mm-hmm. That's the one that I really noticed. And it turned out my testosterone was pretty low in my 40s. So it can be a little bit different for everyone. And we always want women to know that no two women are the same. Your experience is going to be different. So we don't want to use words like always or never because it can really fluctuate or be different woman to woman. But that's the general timeline of symptoms and what's happening with hormones.
So many systems in our body are modulated by these hormones.
Yes.
And so what are we supposed to do? What are we supposed to do? We go to the doctor. Doctors may tell us, okay, have an anti-anxiety med, get on an antidepressant, there's nothing wrong with them. I think they can be so helpful, but our hormones are continuing to decline and fluctuate. So it just makes so much sense. Why don't we try? I know you use the word hormone optimization, which I love. We're not replacing them, but why can't we just optimize them, bump them up to levels so that we can feel like ourselves again? And so hormone replacement therapy, menopause hormone therapy has been surrounded by controversy for years. And I think a lot of the women I speak to are so fearful to even consider that because of the myths that surround it. Can you walk us through the history, particularly the myths created by the Women's Health Initiative study and how they've shaped the conversation and the attitudes around HRT today?
Yeah, and they really have, and it's pervasive. So essentially what happened in the 1990s is the NIH, the National Institute of Health, launched a study called the Women's Health Initiative. We call it the WHI for short. And it was really a study looking at women, older women. It wasn't really perimenopausal women. It was postmenopausal women largely. So it was an older age bracket of women. But what they did is they were really looking to see if hormones could help prevent some of those chronic issues that we face as women, cardiovascular disease, stroke, heart attack, osteoporosis, things like that. In the study, they used what we call synthetic hormones. We can make the distinction, but bioidentical hormones are just the hormones that are made in our body. They're the exact same replica of the hormones that are made in our body. They are made in a lab, so technically they're synthetic if we're using them from outside the body as HRT. There's a lot of arguments about what's synthetic, but these hormones they are made in a lab, but they ultimately, the final product looks exactly like the hormones that are made in the body. Those are bioidentical hormones. The study used synthetic hormones that are not the same as the hormones used in our body. The estrogen was a horse-derived estrogen called Premarin. The progesterone was not a progesterone at all. It was actually a progestin, which is completely different, really, than the progesterone made in the body. So I always want women to know they did study hormones, but they are not the same hormones made in the body. They were both oral formulations, which in and of themselves come with significant risk using oral formulations of those hormones. But what essentially happened is the study launched in the 1990s. It was prematurely halted in 2002 because a sort of subgroup of the study researchers said they did a preliminary review of the data and they misinterpreted their own data in one arm of the study and thought that arm of the study that there was an increased risk of developing breast cancer in the women that were using Prempro, which is the combination of estrogen and progestin. It turned out that was not the case. And even when they actually talked about it and launched it and told the world that we were stopping the study, they said that this risk was statistically insignificant, which in medical terms means we would never make a medical decision based on something that is statistically insignificant. It's not proven to actually have caused breast cancer. And so essentially all of the women and their providers in 2002, when this statement came out and was sent out to the press as that HRT causes breast cancer, sent everyone into a tizzy. Everybody stopped using HRT literally almost overnight. And this was in 2002. Here we are in 2024. Early on, a lot of the doctors that were looking at the research said, hey, this doesn't make any sense, that there actually is not an increased risk in breast cancer. The study researchers, many of them said the same thing. And so that was known early on, but there wasn't a republication of the data until 2017 or 18, where the study researchers essentially retracted their statement and said, actually, HRT does not cause an increased risk of breast cancer. And in fact, in the women using estrogen, there's a 23% decreased risk in developing breast cancer. That has never gone out to the media. And so still to this day, you hear women who say, I am not going to use HRT because estrogen causes breast cancer. Physicians will say it causes breast cancer. There's not a study that has shown estrogen to be the initiator of breast cancer. And yet we are still hearing it being said over and over, largely because of these synthetic hormones that were used in the WHI back in 2002. So it's been debunked, it's been retracted, it's been taken off the table. It's almost like it never should have been said because it was never true to begin with. But there's this disconnect where we just cannot let it go for some reason. It's crazy. So it's a really difficult thing, but I always want women to know there's a great book, Estrogen Matters, that goes into great detail, breaks all of it down for women if they want to get really the meat behind all of this. And I think it's an important read for every woman because it really talks about this pervasive myth. And it's written by a medical oncologist who treated women with breast cancer, and his writing partner, Carol Tavris, is Dr. Avon Blooming. And they go through all the details. So I think it's important not just to take it from me, but read the book, go through the data. It's all laid out really well in terms of where it came from.
And yeah, I know many of the original authors of the WHI study are now taking back a lot of what they said. I was actually at a conference recently and heard Dr. Avram Blooming speak, and he shared emails from people that were the authors of the WHA study retracting what they originally said. This message, unfortunately, isn't getting out to enough women.
No.
I know it can feel like we are in this kind of intense echo chamber where everyone is talking about HRT and we have to get on it. But I don't think that's what incredible educators like yourself or a lot of the doctors are saying. They just want to correct the misinformation that was, established by that WHI study and just give women the right information so they can make the right choices for their bodies.
Yeah.
I know a whole generation of women were taken off of HRT. I feel so sad for people like my mother, who I am visibly seeing how that's playing out in her own health. I don't want it for my generation or for the generation who follow. And still to this day, I know with all this talk about HRT, still there's such a small percentage of women who are on HRT. I don't know if you have the latest stats, but I
feel like it's less than 10% in the US. I think some of the studies or surveys that have gone out, it's 6% of women are on HRT. It feels, to your point, like everyone's talking about it, but we still have super low numbers of people using it. And again, it's just like letting women know, we want women to understand, here's what hormones have been doing in your body since puberty. I think we're so tied to the hot flashes and the kind of miserable symptoms that women may experience as being the most important piece to address in menopause. But I think for someone where I've really dove in, and I know a lot of the people in menopause space have dove in, is we're looking at those silent physiologic changes that
Mm.
occur as hormones decline. And so to your point about your mom, my mom as well, we know for a fact that when women transition through menopause and they lose estrogen and progesterone and testosterone, blood vessels do change. We are at an increased risk of blood vessel disease, cardiovascular risk, stroke, heart attack, things like that. Bone changes, so osteoporotic fractures, which 1 out of every 2 women now experiences a fracture after 50. And this is not just like breaking your arm, like when you were a teenager and you get on with your way, you're casted and you go on your way. For these women, for a lot of them, it means they're going to go into rehab, they're going to go into a facility and never come out sometimes. For some women, I think the stats are like 20 some percent, like 26 to 28% of women will actually die within a year of a hip fracture. We want to do things that prevent and protect our bodies as we age. And when we think about the things that kill women and actually significantly impact their quality of life, things like cardiovascular health issues, osteoporotic fracture, brain changes, genitourinary syndrome of menopause, muscle loss, all the things. That's why we're talking about hormones, because we know that hormones do things in the body to keep the body's cells healthy and functioning the way they're supposed to function. And when we lose those hormone signals, things change. Doesn't mean we can't do some workarounds to try to help our bodies out, but nothing can really replace hormones. Nothing can fill the big shoes that hormones leave behind. So it's really something just for women to think about. And I think a lot of women find it's 10 years down the line and they find out they have a heart attack or they now have high blood pressure and high cholesterol and all these cardiovascular changes, or now they have a fracture and they're like, now I want the hormones. And you can use them, but we'd rather start protecting before something happens versus saying 10 years later when something happens. I just don't think we always tie those changes in our 60s and 70s to menopause. And a lot of these things are happening because of hormonal decline. Aging too, but hormonal decline is a big factor.
Yeah, that's such an important point, that protective and preventative
Yeah.
aspect of hormone decline and the benefits that HRT can offer us.
Yeah.
What are some of the most common and immediate benefits of HRT that women experience? And how does the research suggest these benefits outweigh the risks?
Yeah, I think that, to be honest, I think the top benefit that women experience, I would say almost universally, I hear from the women that I speak with and we see in the research as well, is sleep benefits. When we look at some of the research, people think hot flashes are like the top item for women. The research that I've seen, sleep is the bigger issue. And we all know women that say, I think we just feel like, okay, we're going to just get used to this new normal of interrupted sleep, not having high quality sleep. This is just the way it is. And I think when we go to our doctors, they'll say the same thing. You're in your mid to late 30s. Sleep is just part of it, right? You've got children, you've got aging parents, you've got a job, you've got a busy life. This is just the way it is. You're not going to sleep anymore. But actually, we know that when we bring hormones on board for a lot of women, their sleep will improve. Like that night, like women will say, I can't believe it. In a night, I had a great night of sleep, or I slept 6 hours, or I slept 8 hours, or I didn't get up 3 times a night to go to the bathroom. So I think sleep is the number one. And when we think about just sleep alone, the benefits of just getting really good sleep every single night after night is going to improve all of our health benefits, right? Cardiovascular, our metabolic benefits, we know our energy throughout the day, our mood, our relationships, our function at work. So I always feel like sleep is number one. And I would say the majority of women, I don't think I've heard a woman say, I started HRT and I'm sleeping worse. They're like, oh my gosh, I'm finally sleeping. So I think sleep is that number one benefit that women will experience. Certainly, if it comes to hot flashes, we know that hormone therapy is the gold standard for hot flashes, for vasomotor symptoms. We know for genitourinary symptoms. So if you have vaginal dryness, urinary tract issues, recurring UTIs, things like that, we know that hormones are gold standard treatment for that. So we can see that as some really immediate benefits, or it may take a little bit of time for the vaginal tissue to come back, but it will have benefits there in terms of things that you'll notice. For a lot of women, even things like weight changes, it's not going to be this like heavy hitter in terms of weight, but it can help a little bit with that sort of recomposition, body composition changes. Hormones being balanced can help with that. There's a whole other side to that, because I think people are sometimes thinking, I'll start the hormones and I'm going to all of a sudden lose 10 pounds. It doesn't work that way, but they can help with those benefits as well. Energy, I think for energy, fatigue, mood benefits, like you talked about, a
Mhm.
lot of women are prescribed, like they don't feel like themselves. They don't know quite why something feels off. They get HRT on board and they're like, gosh, I just feel like myself again. Everything feels a little bit more level, a little bit more rosy. It's not so down. There's a lot of really immediate or maybe a few weeks that it takes for women, but a lot of times it will really stabilize a lot of those symptoms in the body that women are experiencing. And I find some women will say, I didn't even realize how bad I felt until I started the HRT. And I'm like, wow, I forgot how good I could feel or how well I used to feel. Now that I'm on it, I'm like, now I recognize that these hormones do make such a difference in the body.
And it's that psycho-emotional aspect, right, of our health that
Yeah.
can be so debilitating
Yeah.
that I think gets so underplayed with this discussion around hormones. We don't even, like you said, you started off by saying how much it impacts our sleep and how much sleep impacts so many aspects
Yeah.
of our lives. But would you go to the doctor and say, please give me hormones. I'm having trouble sleeping. Would the doctor say, oh, hormones aren't really indicated for sleep? You recently gave a public opinion on your IG page and in your newsletter about a recent statement released by the Menopause Society. It was called the Menopause Society Statement on Misinformation Surrounding Hormone Therapy. And it said, I'll quote, it said the use of estrogen, progesterone, or testosterone is only indicated for a select few menopausal symptoms and
Yes.
not as routine treatment option or standard of care. And yes, they're saying that hormone therapy should only be indicated for the treatment of bothersome vasomotor symptoms, genitourinary syndrome of menopause, and prevention of bone loss or reduction of bone fracture risk, and also for primary ovarian insufficiency. But you're saying that it has all these wide ranging benefits that oftentimes stories that I hear from women is that they go to their doctors asking for hormones because they're feeling the anxiety or their low mood, and they're not given hormones. They're given
Yes.
anti-anxiety or anti-depression
Yeah.
medications. Can you talk to us about, I know this made you really upset.
I did. I was like, you could see my reaction. Yeah.
They said, the statement said that hormones don't need to be replaced, right? And
Yeah.
we just need to support women with the certain symptoms that they say are deemed worthy of hormones. So I know this is why you're advocating for the use of hormone therapy
Mhm.
for such a wide range of symptoms, protective and preventative. What does the research say? You dive deep into the research and you say that
Yeah, we
has
see it
these wide
over and
ranges.
over. And we know if a woman has her ovaries out, we know that when women have their ovaries taken out prematurely, they are at a massive increased risk for cardiovascular disease, directly tied to the fact that they are no longer making these hormones. We know, we have seen it in the research. We see the changes. We know that they are at an increased risk for osteoporosis and fractures. So, why the Menopause Society? And I will come out and say, I have always had an issue with the Menopause Society for a lot of different reasons because they lag so far behind the times, because their consensus statements are not about the physiology of the body. They're so, again, narrow minded on vasomotor symptoms, vasomotor symptoms. They used to say that using HRT for the shortest, lowest dose for the shortest duration. That doesn't make physiologic sense. We want to optimize hormones for a woman's body. It may not be the lowest dose. It might be, but it might not be. So we want women to thrive and feel good. I don't know if it's just societal. I guess I always think it's just a patriarchal medical system that we have. We will hand Viagra out like candy to men for erectile dysfunction, but women can't even get some hormones on board for symptoms that are due to hormonal decline. It's not an SSRI deficiency that you have. It's actually hormonal decline that is causing the issue. So why are we not treating the root cause of the issue? We could probably avoid a lot of medications now and into the future if we just addressed hormonal decline. I don't think people realize either that women are living, like we are living a lot longer than probably we were designed to live. In 1900, the average life expectancy for women in the US was 48. 48. So now we live, right? The average age of menopause is 51. So now we're going to live 30 or more years past perimenopause, menopause into our 80s without hormones. And we have to think about that. And the reason we're living that long is because we have all of these medical treatments, right? We keep people alive with antibiotics and all of these surgeries and medications and all the things, but we're not going to optimize their hormones along the way. Can you imagine if we said, I know you have type 1 diabetes, but we're going to try everything but insulin to help, to support your body, or hypothyroidism. We're going to give you everything but thyroid hormone for a thyroid related problem. To me, it's like they're just cherry picking. I don't understand how we are not seeing the body as the hormonal system in the body as being important. And maybe it just comes back to estrogen, progesterone, and testosterone have always traditionally been seen as sex hormones, but they're actually body hormones. And I think if physicians and nurse practitioners and the medical community understood that hormones play a role throughout the body, this would change. But I feel like that education is sorely lacking, even in medical schools. They don't teach providers about hormones. They don't teach our gynecologists about hormones. We as women and educators and all those of us that are beating the drum are like, this is what hormones do in the body. Why are we being averse to bringing hormones in the body for something that is related to hormone decline? It's just physiologic sense to me. It's just logic.
Yeah, no, it makes so much sense. I know at the end of the day, it is a personal choice, and we'll talk about how women can make that choice for themselves. I'd love to have you explain the different options women have in terms of HRT, because not all HRT is created equal. Can you explain the different types of HRT available, including bioidentical hormones, and what that means, bioidentical, and which options women might want to avoid?
Yes. So when we're talking about hormone replacement, to your point, you said it earlier, I don't love the word replacement because we're not trying to get to the levels that we had when we were in our premenopausal years, right? We're just trying to get enough of these hormones in that we get some signals to the cells of our body, and so that we are keeping the cells of our body healthy. So we're not trying to bring in these massive amounts. We're not trying to bring a period back. We're just bringing in some level of hormones so we can optimize hormones throughout the body. So when it comes to choices with hormones or hormone replacement or hormone therapy, there's a wide variety of options. And I think we have like good, better, best in some ways. Initially, there's different types. So we've got bioidentical hormones, which just means that the hormones are the same hormones that are made in the body. So estradiol that is made in the body that we would get from the outside would be the exact same. From our body's perspective, it doesn't know the difference. It can't tell the difference between the two because they're exactly the same. Estriol, if you're using estriol or bias, which contains estradiol and estriol, it would be the same estriol made in the body. Progesterone, bioidentical, is the same progesterone made in the body. Testosterone is the same. So we have these bioidentical or body identical hormones. And then we have this other type of hormone, which is what we call synthetic hormones. And synthetic hormones are basically, pharmaceutical companies cannot make a profit off of bioidentical hormones. They are not allowed to patent bioidentical substances made in the body. So if they want to make money off of a type of hormone, they're going to have to do something different with it. So it can be the delivery system. It can be, they change the molecule a little bit and it's called something else. And that's basically what synthetic hormones are. They've altered that molecule a little bit. So it's not the same as the hormones that are made in their body. So they're really two distinct biological substances in the body from a molecular standpoint, the way our body looks at them. Under the bioidentical umbrella of hormones, there's lots of different options, but there's also FDA approved. The FDA has approved a number of bioidentical hormones. You can get them that are FDA approved. And then there are also compounded bioidentical hormones, which means they come from a specialty pharmacy and they are more customized to you. So the FDA formulations, the reasons why someone might use a compounded formulation is, number one, testosterone. There is no FDA approved testosterone for women. So a lot of times we'll go to a compounding pharmacist for that. If a woman wants to use two types of estrogen, estradiol and estriol, there is no FDA formulation. So she'd go to a compounder for that. Progesterone, the FDA approved, is called Prometrium. It contains peanut oil, yellow dye, red dye, things that a lot of women don't want in their body, or if they have a peanut allergy, they don't probably want to use Prometrium. So they can go to a compounder to say, can you make me the progesterone, but without those added dyes or without the peanut oil? So it just offers more customization with dosing, not to get too into the weeds, but even the size of the particles matter because we're putting a lot of these hormones on our skin. The size of the particle matters. Can it get through the skin? So if someone's struggling with the FDA approved formulations and their levels aren't getting high enough and it's not really, and they've changed their doses and they've done all the things, sometimes some of the compounded formulations can just be more tailor-made to the individual, or maybe a more bioavailable molecule that can get through the skin, a smaller particle. There's just a lot more wiggle room in terms of customization for a woman.
Great. Thank you so much for that. And what can women expect when they go on menopause hormone therapy in terms of the time that it takes for the hormones to take effect, any side effects? How much time should we give it before we go back to our doctors and try maybe a different dosage or delivery system? You do have to go through a little trial and error period, and you have to be patient,
You
right?
do. You do. Yeah. And your starting dose will not be your final dose, most likely, because we don't know. We can't look at any one woman and say, looking at you based on your age and where you're at, I think this is the dose for you. We have no idea. So I don't prescribe hormones because I'm a nurse, but I've done a lot of my training. I've done a lot of different hormone trainings, but I've done a lot with Dr. Rosensweet at the Institute of Bioidentical Medicine. He's been a doc for 50 years. He's been prescribing for 30 years. And I like his method, the way that he does it. Now, your provider might do it differently, but one of the things I like is that he really takes into account that women are so unique. So the way he prescribes the hormones is you start at a very low dose of estrogen and you use that for a week to 10 days. And if you don't notice any difference, you're going to slightly increase that dose. And I mean slight. And then you'll use that for maybe a week to 10 days, 2 weeks. And if you don't notice a difference, it's sort of a titration. So the idea is that with estrogen, you start at a lowish dose and then you slowly titrate up until you feel like you have experienced symptom resolution or significant symptom relief without feeling symptoms of like excess hormones. And if you do, you just back down to your previous dose. So I love that methodology because it puts the sort of the titration in the woman's hands. Like you live in your body, what feels good. You can experiment and see where you start to feel best in your body. Because a lot of times what I see is prescribers give one dose and say, okay, now come back in 6 months. We don't know if that's the right dose. And if you don't feel anything different, a lot of women are hesitant to go back. I don't want to bother my provider. When you start hormones, there should be this back and forth period with your provider, no matter how they prescribe it, to say, we're going to check in a month. Or if you're not feeling better in a month, let me know, so that you are adjusting your dose, because perhaps it's either you need a higher dose, maybe you need a different formulation. Like I was, explaining, sometimes people absorb well through the skin. Sometimes they don't. There's different types of hormones. So there's a lot of sort of tweaking and adjusting that can be done. So with estrogen, we typically titrate. With testosterone, we typically titrate as well. Progesterone, kind of the same thing, but we usually start at a little bit of a higher dose because we know that there's a lot more progesterone in the body than estrogen. So we'll usually start a woman on, let's say, 100 milligrams of progesterone, or sometimes even 200 milligrams, a little bit higher dose versus starting at 5 milligrams and tweaking up. So that's a process. And so if you don't feel better, you absolutely want to go back to your provider and say, I don't feel anything, especially if you have very overt symptoms. If hot flashes are not going away, sleep is not getting better, if mood is not changing, if the genitourinary symptoms are not changing, you want to go back to your provider. Some symptoms will take longer. Vaginal symptoms can take 6 weeks or more. There's different variation, but this is where that back and forth with your provider and the partnership can become so important. From a side effect perspective, you were asking, I think, about the 4 Bs as being the big one. So bleeding, bloating, breast tenderness. Bitchiness. I always say bitchiness, where you're kind of like, I just had this really strong reaction. So a lot of women will have bleeding. It's not uncommon. It's not something to worry about as you are titrating your dose. It's, again, finding that right dose. We usually tell women expect to have some bleeding, even breakthrough bleeding within the first 6 months of starting HRT. If you adjust the dose, again, another 6 months of that HRT. So knowing that bleeding can happen is something that I always want women to be aware of. Breast tenderness can happen, even if it's the right dose. It may just be your receptors are like, oh, okay, we're bringing some estrogen on board. There may be some sensitivity there. So we want to make sure we're aware of these different side effects, but typically for most women, they will dissipate once their body starts to get used to those hormones again. But again, if anything is problematic, you just talk with your provider and they can help tweak or fine tune, or maybe it's an imbalance with one of the other hormones that they need to tweak or fine tune. Yeah.
And then finding the right healthcare provider that you can have this type of dialogue with is so important, right?
Yes.
It can be a challenge to find the right health practitioner for menopause. What should women look for in a qualified practitioner who prescribes hormones, and what questions should they ask during consultations or even maybe before consultations?
I always tell women, get some education under your belt
Mm.
about hormones and HRT and just sort of the lay of the land in terms of the changes that are happening in your body so that you can at least go into your doctor or nurse practitioner and have some baseline knowledge about it. We read a million pregnancy books. We buy books when we are going to bring a new puppy home. We need to get educated about this phase that we're going to spend 30 to 40 years in. So we do want to spend some time getting educated ourselves. Going into the provider, I think asking questions like asking them about, do you prescribe hormones is a great question. A lot of women will wait for their annual OB appointment or GYN appointment, thinking that their GYN is the person. And they're like, I'll just wait. It's in 3 months. I'll talk to them about hormones. Most OBGYNs are not trained in hormones. If they are, it's because they've gone out and sought out training in hormones and HRT. So I would say make sure that is an area of expertise for them. You can call their office and say, do you prescribe hormones? Is that part of what you do? Menopause providers who are in the know are going to be very well versed in prescribing hormones. And if they are really thinking about the woman and doing that personalization, they're going to have a wide buffet of options. So I would just ask the office ahead of time, do they prescribe HRT? Do they have other recommendations? Do they do that sort of 360 support of women in menopause? If you're looking for that 360 support, meaning supporting you with other pieces, lifestyle and other things, calling the office ahead of time can save a lot of time. Looking at their website, you're going to get a sense of whether or not this person is a menopause expert. And I always say, find the expert, not the person that kind of dabbles in it. Oh, I do hormones sort of on the side, or I went to a weekend seminar and now I'm prescribing. You want someone that is really spending the bulk of their time with menopausal women because that's how they get good at treating menopausal women. It's like internal medicine physicians all did rotations in different areas. And so they have this wide variety of things they can do, but you wouldn't ask them to operate and cast a bone for you or do orthopedic surgery or do some really nuanced, specific specialty type of treatment for you. So we want to find the person that really understands hormones well. And so it could be calling a compounding pharmacist in your area or compounding pharmacy and saying, hey, who do you guys know in the area that is licensed in my state that knows hormones really well? They're a great resource for that. And I think you and I had talked about that. There's a lot of telehealth options now, some better than others, but I think it's not even about the actual telehealth company. It's always going to be provider specific. It's like anywhere you go, right? Some providers you love, some are not so great. It's about bedside manner. So you may have to go through a few to find the right one for you, but doing a little bit of that detective work and homework in advance is really, I think, helpful. And then finding out their process. What does that look like? Are we going to have this back and forth discussion? What is your hormonal sort of, if I start HRT, what kind of access do I have to you? What kind of support? If it's not working, can we change it? Like understanding how they approach HRT is really important, that they're not just prescribing and saying, come back in a year. So just understanding their process, I think, can be really helpful for women.
Yeah. And making that appointment specifically to talk about hormones outside of your yearly checkup. That's such great advice.
Yeah.
A question that came through from one of my Instagram followers, because I did a little shout out, send me your questions for Jill, was, do I have to wait for that one day when my period stops for a year? I think this is what may be a little bit confusing for some people. They just wait when we know that perimenopause window can last, like you said, 5 to 10 years. And meanwhile, there's enduring suffering with the anxiety, the debilitating symptoms, and their doctors tell them you have to wait for that one day when you're in menopause.
Yes. And we don't. If a doctor says that to you, they are not a menopause expert. That is like a very kind of a giant red flag. If they say you have to wait until your last period to come in to have hormones, that's absolutely a red flag that they don't know about menopause. So I always tell women in your 30s, menopause will happen to everyone. Perimenopause, there's no woman that is going to escape perimenopause, just like none of us escape puberty. It's going to happen no matter what we do. Best lifestyle things on the planet, which I think is really important. Lifestyle is important. But no matter what you do lifestyle-wise, your ovaries are going to stop producing hormones, and you're going to have a very long window of time where they are kind of spottily producing hormones. It's like the spotty Wi-Fi signal. Sometimes they're producing hormones, sometimes they're not. So in your 30s, start to research if you are in your 30s. If it's after 30s, that's okay. But early on, we know these changes tend to happen in our mid to late 30s. So I would say start researching that provider. You can make that appointment, even if periods are perfectly regular, doesn't matter. Saying, hey, I know this is coming. And so I want to start meeting with people to see who is going to be my provider. We do it. A lot of women do it when they're pregnant to find the pediatrician, right? For their baby, once their baby's born, go out and start to think about who you might want to work with during this time. You do not have to wait. And in fact, all of the research that we look at shows the earlier the better, right? The longer we go without hormones, the more vulnerable our blood vessels are, the more vulnerable our bones are, all of the systems of our bodies. So if we can start bringing hormones in, don't wait till they're rock bottom. But as they're on the downward decline, that's when we're bringing the hormone in versus waiting until we're at that sort of like, you see it a lot too, Gabrielle. It's I'm hanging by a thread. Are my symptoms bad enough yet? No one should make you feel like you have to suffer longer or your symptoms have to be that bad. But this is where I always say to women, track symptoms. And I should have said that when we were talking about a provider. Track your symptoms, because when you track symptoms, you really get this insight into what's happening in your body. And then you can go in with confidence and say, hey, I'm seeing all of these changes, even if they're not period related. I'm starting to see the symptoms associated with hormonal changes. I'm having sleep issues or anxiety. I'd like to try progesterone. And why not start with the hormones? Because that's the most likely reason for changes, sleep changes, and anxiety and other changes happening in our mid 30s. So I always say start with the hormones and see what remains. You're going to know if the replacing hormones works pretty quickly. If it doesn't, maybe you need to look elsewhere to see if there's something else going on. But usually bringing hormones in during that time is going to be, it's pretty magical for a lot of women. They're like, wow, it was just the hormones that were changing.
Yeah. And
Yeah.
what about for postmenopausal women who have gone beyond that 1 year of no periods? Is it too late for them?
It's not. It's never too late. I think what women need to know too is we don't have a lot of research on women in general. The medical community didn't start doing research on women until the 1990s. So we really only have, 30-ish years of research on women. We have very little research when it comes to hormones, especially long-term hormones. What we're seeing is the most ideal time is within 10 years of menopause in terms of protection. So preventing blood vessel changes, preventing bone loss, preventing things like maybe Alzheimer's, dementia, things like that. But at any time, again, with symptoms, a lot of women are even 10 years out and they're like, I'm still having hot flashes. I thought they were going to go away. Or I had a fracture, I have bone loss. You can start hormones later as well. There is the timing hypothesis, which just means earlier is better from what we know in the research. But again, we individualize the conversation. If you have a woman who's saying, I'm still suffering, or I want it for these bone benefits, or any woman can have vaginal estrogen at any time, I have those genitourinary system changes. Absolutely, there should be no cutoff for women. And again, it's this benefits risk discussion with each woman and her provider.
Such great advice. Thank you so much. I love that you talk about breaking free from the idea that disease and decline are inevitable parts of aging and that hormones can play a huge role in that.
Yeah.
And taking this really proactive approach to menopause can shift this narrative. What are other proactive ways that women can take to shift this narrative?
Yeah, I mean, this stage of life, I think we are in a society that is all about productivity and 24/7 and go and doing, 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 doing. And menopause is going to be, for most women, somewhat tumultuous. And I think that's almost on purpose. This perimenopause to menopause transition is like your body saying, hey, Tap, things are changing and you need to change. So even if you're bringing HRT on board, whether or not you are, our bodies are shifting pretty drastically because, again, we have this huge decline in hormones, along with the fact that we are aging, right? We've been on the planet for a long time. So this is that time where we want to start really thinking about those foundational pieces of health. In our 20s, we could survive on pretty crappy food and it wasn't a big deal. Food is really information for our body. It's telling our cells what to do, how to behave. So we want to start thinking about up-leveling our nutrition, right? We want to start thinking about the way we eat food, not shoveling it in, but slowly eating our food so we're actually getting these nutrients into our body, getting to the cells that we need. We want to be thinking about exercise. I know we've talked about strength training. We lose muscle pretty drastically as we age. It accelerates once we're in this sort of midlife stage. And muscle loss, it's not just about the vanity of muscle loss, but if we see muscle loss, it means bone loss. So we want to do things like exercise. Yes, the walking is really good. The cardiovascular or the cardio exercise can be good, but more importantly is going to be things that stimulate our muscles to grow. And we need a lot more stimulus on them because we don't have the same stimulus we had before with having hormones on board, even with HRT. So strength training becomes really important. I think we go through also this like psychological shift. A lot of women are like their identity, everything, it's this midlife moment. So really connecting to what is this next chapter about for me? What do I want for myself? Thinking ahead about if I want to be thriving in my 80s, what do I need to do to get there? And I think a lot of women, we just are so in the business of doing. We don't stand back and think, are the things I'm doing today setting me up for this really healthy, vital future when I'm in my 70s and 80s? And so I think just creating that midlife strategy for ourselves, say, just checking yourself, really checking the exercise, the sleep, the stress, the nutrition, the relationships, our jobs, whatever it is that feeds into that. Start thinking about that now, because I think we have seen the women before us decline, and we do not have to decline, but we do have to do something about it. It's going to take a little bit of action, a little bit of effort on our part, which can be very daunting when you don't feel like yourself. It's a big change in life. It's a big change.
And I think this strategy is so important, especially for women who don't want to take HRT. So we're just giving information here. We're not telling women this is what you should do. It's so important to have that conversation. Every woman deserves that conversation around HRT and to make that choice for themselves. But this strategy, all these extra lifestyle modalities that you talk about, strength training, nutrition, our emotional well-being, seeking out community and like-minded people, all those things are so, so important as we move through this transition, regardless of whether you take HRT or not.
Absolutely. So important. Yeah.
You have a wonderful online community, Pausing Together. It sounds like such an empowering space. How do conversations like these about hormones, health, and aging help women feel less isolated during this transition?
In the community, we do a lot. It's a lot of back and forth about how women are feeling. And it's so interesting. I've been back and forth with one of my members over the last couple of weeks. And this is very common where women are struggling with things. And what I hear all the time is, I'm so grateful for this community because I feel like I'm not alone. Because I think we feel like we are alone and it must just be us. And I think especially with the online space, Instagram or whatever you're looking at, you think everyone's got it together. You think it's great for her. She's not suffering through it, but all women are going to go through this. And so I think just understanding that you are not alone. We are all going through this. Even if we look like we've got it all together, trust me when I say we don't, we all ebb and flow. So I think it just helps us to understand that we are not alone. And also that the community really helps women to see that there are things, to your point, that there are things we can do to really help support ourselves. We're not victim to this. We can actively participate in our health. And I think that's not something that we've been taught in the past. A lot of it is like sitting on the sidelines while the doctor says, here's what you're going to do. We now know that the lifestyle choices we make and the other things make such a difference. So this community is so much about that too, just that there's so much we can do to really help ourselves thrive as we age versus going down that road to decline.
I love that. Thank you for that. And we can join your community at your website, right?
Yes. Yes. I have the community and then I have a guide called The Beginner's Guide to HRT, which is in process of being updated. It's a couple of years old. And so I'm adding a lot to that. So that will be coming soon. But yeah, there's a content library. We have Q&As with a physician every month. We've had guest experts. And then there's a lot of conversation in the group as well. Yeah.
I downloaded that HRT guide and it is so helpful. Even though it needs to be updated, it just the basic information, a lot of what we talked about here is on there in much, much more detail. And I would just take that guide with you to a doctor's appointment, right?
Yes. Yes.
Use it as your script for
Yes.
approaching your doctors. It's so important to go prepared to have that first conversation about hormones. Everyone deserves it. Everyone deserves to have that conversation. Yeah. We're nearing the end of our time together. Sadly, I want to have you back to talk about so many other things. A question I always ask my guests is, what does pleasure mean to you, Jill?
Oh my gosh, especially at this age, I think so much of what we've done as women has been about serving other people. And so pleasure to me is, I guess I feel like in midlife, it's really about, I don't want to say it's just about me, but it's not selfish to do things for ourselves. And so pleasure for me, I feel like it's like broken wide open now in this stage. I'm finding myself finally able to concentrate on myself and just choose things that nourish me and make me feel good and make me feel happy. And they're beyond. It's like being with girlfriends, and it could be being with my husband. It might be hiking out there, but it's just having this like kind of 360, like all the things, really look at all aspects of our life is really what I feel at this stage is that's what pleasure is all about for me.
So beautiful. Yeah.
Mhm.
And we can do it guilt-free
Free.
and know that we are so worthy of it.
Yes.
Beautiful. Tell us, how can listeners connect with you?
I'm on Instagram, so you can find me there. And it's just and then it's Jill.Chmielewski. I have a website, which is jillchmielewski.com. If you go to pausingtogether.com, that's where you can sign up for the community. So those are really the three ways. I don't see patients anymore. I stopped about 3 years ago, but there's a lot of sort of group education and you'll definitely have access to me in the community. So if you are interested in that, that's a great place for us to connect.
And I'll put all of that in the show notes. And I can attest to being in your community and really finding it such a supportive space. So
Yeah.
highly recommend. Thank you so much,
Thank
Jill, for your
you.
time, for your presence, for sharing so much of your expertise and knowledge with us today.
Oh my gosh, thanks so much for having me. I was so happy to be here.
I hope you enjoyed this episode of Pleasure in the Pause. Want to help me spread more pleasure in the world? Hit the share episode button and send it to a friend or post it on your Instagram stories and tag me, Gabriella Espinosa. And if you really love this podcast, please leave a rating or review, as this helps the show get in front of new listeners. Finally, if you would like to access even more pleasure and stay in touch, sign up for my free pleasure upgrade bundle of powerful mind-body practices by going to pleasureinthepause.com. Remember, your pleasure matters.